Before I answer the question, I want to shed some light on some statistics that will really, shed some light on some of those health disparities. So in reference to mental health, Cigna reports that Black patients are 20% more likely to report psychological distress and 50% less likely to receive treatment for those illnesses. Black patients represent as much as a third of all US patients receiving dialysis for kidney failure, though they don't represent anywhere near that amount of the US population. They're at about 13.4%. The American Cancer Society says that for most cancers, African Americans have the highest death rate and shortest survival. Black women are 3 times more likely to die from a pregnancy-related cause than white women. That's about 55 deaths for every 100 live births. So to just give you some comparison, in Canada, the maternal mortality rate is 8 deaths per every 100. So roughly 7 times less than what Black women in the US experience. Black newborns die 250% more often than white newborns in the United States. In relation to COVID, 2020 data suggests that 17% of deaths in the US related to COVID were among Black individuals, and again, much higher than the actual percentage, 13.4. So those are some striking statistics, but not all of the statistics, right? So now that I've given you an idea of what those health disparities look like, let me answer your question. So how does structural oppression contribute to the health disparities? It doesn't only contribute, it's the root cause. So to piggyback off of what Dr. Rogers was saying, transgenerational trauma also a cause of those health disparities. Structural racism is one of those root causes. So there's a longstanding fallacy that that there are genetic or biological reasons that, Black health is, the health disparities are where they're at. And unfortunately, that lie kind of still persists today, even though this information that structural racism is at the root of Black health disparities is not new. I'm not breaking ground here with this information, but it hasn't been, while their awareness is there, the action hasn't been behind it to really move that momentum into actionable change, right? So some of the ways that the disparities show up in the healthcare system, insurance coverage gaps. So even with the Affordable Care Act, there's still huge insurance coverage gaps, unequal access to care. Predominantly Black zip codes are 67% more likely than other zip codes to lack adequate primary care physicians. Provider bias, both unconscious and conscious bias, and lack of quality and culturally competent care. So those are the ways that structural racism shows up in the healthcare settings. So, to wrap up, the COVID pandemic and the racial social justice pandemic that we just went through really brought with it a heightened awareness and concern for structural oppression and health and well-being in the Black community. And I'm just hoping that we don't lose this momentum that we have and we continue to move towards not only awareness, but action, like you said, Caitlin. That's the most important step. I think the awareness is there and it's been there, but really moving towards making some actionable steps.